The androgenic anabolic ratio of halotestin is insane. On the androgenic side, it is 850, and on the anabolic side, it is 1900. That means, on paper, it is about 8.5 times more androgenic than testosterone, and 19 times more anabolic than testosterone, which sounds completely amazing on paper, but in reality, halotestin, one of the most potent steroids for increasing strength and aggressiveness, but at the same time, it is also one of the harshest oral steroids out there when it comes to health. It is a favorite among many powerlifters, boxers, and MMA fighters. So, I made this video to talk about the real reason why this drug has been so favored by these athletes. We will also cover its history, medical uses, and its unique properties. Additionally, we'll explore its role in bodybuilding, including dosages, benefits, and potential side effects, and what you can expect when using it. So, if you are a bodybuilder, powerlifter, fighter, or just someone curious about halotestin, this video will cover everything you need to know about it. And now, let's start with the history and medical usage of halotestin. Halotestin was first described in 1956, and then it was released to the US market under the brand name Halotestin by the pharmaceutical company Upjohn, which is now part of Pfizer. After that, CIBA released halotestin to the market under the brand name Altandrin. Halotestin was prescribed for both men and women. For men, it was used to treat low androgen levels, and for women, to treat advanced breast cancer, and also, of course, to help patients rebuild lean muscle tissue after operations, burns, and fractures, and even to combat catabolism resulting from long-term cortisone therapy. In recent years, it is no longer commonly used by clinicians because halotestin is one of the harsh oral steroids on the liver, and it has a significant impact on cholesterol levels and heart health. That is why nowadays they prefer to use testosterone over it, as it is a much safer compound. And now, let's talk about the structure and characteristics of halotestin. Halotestin is just the brand name, while the chemical or generic name is Fluoxymesterone. Halotestin is derived from the hormone testosterone, and to be specific, it is actually derived from methyl testosterone. The half-life of halotestin is anything around 5 to 9 hours. This means it should be dosed twice or 3 times per day to maintain stable hormonal levels. But don't worry, we'll talk about its application later in this video. Now listen to this. The androgenic anabolic ratio of halotestin is insane. On the androgenic side, it is 850, and on the anabolic side, it is 1900. That means, on paper, it is about 8.5 times more androgenic than testosterone, and 19 times more anabolic than testosterone, which sounds completely amazing on paper, but in reality, it is not like that at all, because halotestin is actually a weak muscle builder, but it is very powerful when it comes to increasing strength and aggression. That is why I always look at the anabolic androgenic ratio as a more of guideline, not something to rely on 100%. It is important to remember this ratio is based on lab experiments on rats, so it doesn't always translate perfectly to real-world results in humans. And now, let's talk about the side effects of halotestin. Halotestin is classified as an androgenic oral steroid. That means its androgenic side effects are very common, which can include things like acne, body and facial hair growth, or hair loss for people who are genetically predisposed. Also, one of its most common side effects, it can make you a very aggressive person and put you in a bad mood. The 5-alpha reductase enzyme, which normally converts testosterone to dihydrotestosterone, when it interacts with fluoxymesterone, it can convert it into even stronger androgens, which are more active in the scalp, skin, and the prostate. That means taking a 5-alpha reductase inhibitor like finasteride might help reduce some of its androgenic side effects, but don't forget, drugs like finasteride come with their own side effects, and they will reduce the overall results from using anabolic steroids. Now, when it comes to estrogen-related side effects, halotestin does not aromatize in the body, which means it doesn't convert into estrogen. So, you don't need to worry about things like gynecomastia or high water retention. Regards liver stress, halotestin is a C17 alpha-archelated steroid. This means it's chemically modified to protect the hormone during oral administration. This modification protects the drug to be deactivated by the liver, allowing a very high percentage of the drug to enter the bloodstream to exert its actions in the body. But this chemical modification comes at a cost. It puts a significant amount of stress on your liver. In fact, halotestin is considered one of the harshest oral steroids on the liver. This is why it is strongly advised to use liver support supplements and to limit the duration of halotestin use, typically around 1 to 3 weeks max. When it comes to cardiovascular side effects, halotestin, like all other anabolic androgenic steroids, will negatively impact cholesterol levels. And in general, oral steroids are more harmful than injectables when it comes to skewing your cholesterol. These compounds tend to decrease HDL, which is known as the good cholesterol, and increase LDL, which is known as the bad cholesterol. This shift in HDL to LDL ratio can raise the risk of cardiovascular diseases. Also, halotestin can significantly raise your blood pressure, so it's important to check it on a regular basis and keep it under control. So, following a strict diet, supplementing with healthy fats, and doing cardio can help reduce some of these negative side effects on cardiovascular health. You may even need to introduce blood pressure medications like ARBs or beta blockers to help control both your blood pressure and heart rate. But let's be real, this risk cannot be completely eliminated when using anabolic androgenic steroids. Before we move on to the next point, which is halotestin and testosterone suppression, if you found value in this video, please give it a like, subscribe to the channel, and click the notification bell so you get notified when I upload the next video. And now, let's talk about halotestin and testosterone suppression. Halotestin, like other all anabolic androgenic steroids, will cause suppression of your natural testosterone production, especially if it is used for several weeks. And since halotestin does not aromatize, that suppression will also lower your estrogen levels. So, as I always say, testosterone should always be used as a base, because it is the primary hormone your body relies on for proper function, and it converts into both DHT and estrogen, which are necessary hormones not only for overall health, but also essential for muscle building, recovery, and performance. Now, halotestin is a kind of a special case because people usually run it for a very short time, just to boost strength, aggression before powerlifting meet or a fight. And in those short windows, it probably won't be enough to full shut down your natural testosterone production. So, if it is used alone and only for a very short duration, a full PCT will probably not be needed, and recovery should be much easier. But now, let's talk more about its application in the real world and why do athletes actually use halotestin. Halotestin has several applications in sports. It is commonly used in powerlifting because it can significantly boost your aggression and strength instantly. That is why it is often used right before a powerlifting meet or even during a training block to help break through a strength plateau. Halotestin is also a very suitable compound for combat sports like boxing and MMA because it increases strength and aggression before a fight. But here's the key part. Halotestin is not a good muscle builder at all, and that actually makes it a great option for fighters. Since most combat sports have strict weight classes, so adding size or mass is usually not an option. But now, let's talk about halotestin dosages for medical conditions and how it is commonly used among bodybuilders and athletes. The prescribed dosages for medical conditions for men are typically around 5 to 20 milligrams per day, and we are talking about long-term therapy here. Now keep in mind, 20 milligrams is not a low dose at all, but the therapy would always be adjusted based on the lab work and how the patient responds to side effects. The prescribed doses for women, especially those with advanced breast cancer, as a last resort therapy after trying and failing other treatments is around 40 milligrams per day, which is a very high dose. And of course, women can suffer from virilization symptoms even at a much lower doses of halotestin. That is why it is absolutely not recommended for women for any physique or performance-enhancing purposes. Among bodybuilders and athletes, the most common dose ranges between 10 to 40 milligrams per day, and it is usually taken during the last 1 to 3 weeks before a show. This is done to boost androgen levels and to achieve that grainy, dry look on stage. Also, at that point in prep, you are depleted and exhausted, so halotestin will help you keep training performance high. Halotestin can be also used during the off-season to overcome strength plateaus. Now, some users take it daily, splitting the dose into 2 or 3 times per day, while others use it more like a pre-workout booster, maybe even before training specific body parts only. Now, let me just share some personal thoughts for the people who are really swearing by halotestin, especially during contest prep. You are more likely running 3 different injectables and at least 1 oral like Anabar or Winstrol. You are likely on fat burners too, and you are already very lean at this stage. Not to mention, you are probably manipulating carbs, water, and sodium. Some may even be adding diuretics close to the show. So now, you have got so many variables in play. The real question becomes, how much is halotestin really contributing at that point for this hard, grainy look on stage? Especially considering that it is not a good mass builder at all, and it is one of the harshest oral steroids out there. Now in the off-season, yes, halotestin might help push through a strength plateau, but it can also mess with your appetite, and again, it doesn't help you put on much muscle mass, which is the main focus in bodybuilding off-season. I'm not saying it's a bad drug at all, it definitely has its place. These are just food for thought for those considering it. And now, let's move to the availability and supply of halotestin. The halotestin brand is no longer produced, and today it is really hard to find pharmaceutical-grade Fluoxymesterone. Most of the current supply comes from underground labs. It is produced only in tablet form, usually dosed at 5 milligrams, but mostly 10 milligrams per tablet. You might find it sold under different brand names such as Halotest, Halobol, or Halabolic. But remember, these are just brand names, but the compound itself stays the same, Fluoxymesterone. Now, a very important point I need to mention, the raw material of halotestin is very expensive, so it is very commonly faked. And that might be another reason why many people prefer another oral steroid that gives a hard, dry look and a pretty good muscle builder. This oral steroid is Winstrol, and I have made a detailed video about it. So, click on the video to learn more about Winstrol.